I chose it because also to challenge myself, but also, I was struck by some recent, even in the literature and the MMR about how few people really do understand this condition. And I think we probably do need to, because it is really increasing. And if you haven't seen these patients, you probably will. And it's not just going to impact allergy, my field, but it's going to impact other medical fields as well. So hopefully you get that understanding. So I'm not representing FDA today, and I also other people who are, it's just, want to reiterate that, this is a type of disease that really needs good science. And it's a really sad time right now that science is getting attacked. And I think we need to be strong and follow through, because this has as hopefully you will understand, some important implications for the patients themselves, but also as we are trying to improve management and avoid serious reactions. I'd like to talk hopefully I think the story of how alpha-gal became known is really interesting, and hopefully give you a little bit of an insight on that. And just also some of the interesting pathophysiology of why this is happening. This is really a paradigm shifting disease in allergy. Really took a while for the allergy community to accept this, and I'll explain why. And obviously talk about some important diagnostic and clinical aspects of the syndrome, and then also where it might be important to all of us in medicine in recognizing and managing patients, because it can be difficult. So, this slide, when we talk about tick-borne illnesses, I'm sure everyone points to the infectious disease potential of ticks. And there's many different ticks and transmitting different types of diseases listed here. Important to realize is that there has been an increase in the amount of diseases and illnesses due to tick-borne diseases, probably a doubling reported in the last 13 years in the CDC reports. And so this sets the stage for another type of problem that is occurring. Many of you might recognize this tick in particular. It's going to be one of the main ones I'm going to talk about, but with the little lone star there, that's actually the female tick that has that. But this is a condition called alpha-gal syndrome now. It's coined. Really coined in 2009. So very recent, even though tick bites have been around for a long time, just really making its way known recently. And it's increasing, okay? Almost, some people who say epidemic proportions. It's characterized by two types of main presentations: immediate anaphylaxis to certain drugs, but also delayed meat allergy and anaphylaxis. And I'll talk more about that. So probably the study that put this on the map was this paper in the New England Journal on cetuximab-induced anaphylaxis. So just to let you know, back in the early 2000s, clinical trials were being done for this monoclonal antibody cetuximab in the treatment of metastatic colon cancer. It's also used for other types of squamous cancers now. And during these trials, it became pretty clear early on that a certain subset of patients were having hypersensitivity reactions. And then when they actually looked at that, about 3%, they found that a very high proportion were from certain trial sites in the southeast of the US, Tennessee and North Carolina. People, started to find, why is this happening? And, as we know, cetuximab is one of the, it has a half murine from mouse made antibodies. And sure enough, this study found that the likely source of these reactions were due to Ig antibodies to the FAB portion, heavy chain of the FAB portion of this molecule, which has quite a few different types of alpha-gal epitopes. And interesting here to point is that this was also made by UVA researchers who had developed an antibody for other reasons to alpha-gal in their lab, and that's how they discovered this. So then what is alpha-gal? It's a carbohydrate found in most mammalian cell membranes. This is a bee-like oligosaccharides found on mammalian blood cells. Humans and primates and other primates do not have this carbohydrate because they lack this specific gene, the GGTA1 gene. Okay, now lacking this gene does offer some protections in terms of, because there are some microbes that have alpha-gal, and so by default humans make IgG antibodies to alpha-gal, and that helps protect against some of these other pathogens. But as a result, having this lack of gene does make us susceptible to transplant reactions if we were ever to get transplanted from mammalian sources. So it's a very important transplantation barrier between humans and mammals. So how does the red meat allergy collection occur? Well, interestingly, during the same time, researchers at the UVA were seeing a number of patients coming in with some strange complaints. They also were outdoors hunters and so forth, had outdoor exposures, and they were complaining of generalized urticaria, angioedema, and even recurrent anaphylaxis. And in some cases, they were saying, yeah, it seems to happen after I eat meat, but not really right away. It happens hours later, sometimes even in the middle of the night, they're getting these reactions. And so, so they started investigating this, and they found that doing skin prick testing, that's what, we do as a first stage if we want to understand if something's allergic, with like the types of mammalian meat products, beef, lamb, and pork, they would get these very low positive reactions. Many cases, we may not even consider them positive when you look at them. However, because of their convincing history, they decided to do some intradermal testing. This is kind of the next stage when we want to try to elicit a reaction that we don't get with this initial percutaneous test. And sure enough, doing that kind of testing, they got these you can see here, very strong responses to beef, pork, and lamb, but interestingly, not to chicken or turkey, or to mites, which are insect-derived. And here on the left, you can see, some of the reactions that they had. Small reactions, but not much to note. And eventually, they also did a test, and they found that these blood tests were also specific to IgE antibody to these meats as well. Okay, so they have that information. But this was still pretty strange for a meat allergy, okay? Because we have, information on meat allergy. Most of the time, a meat allergy is kind of like a regular food allergy. You get immediate hypersensitivity within an hour or two of eating the food. And the proteins that are involved in most meat allergies are shared among mammal, poultry, and other species, kind of such as collagen, gelatin, albumins, etc. So it didn't make a lot of sense why, there was only reactions to just mammalian products, and that they're delayed as well. There's children with atopic dermatitis. Ingestion of beef can cause elicitation of their eczema and so forth, and maybe in some cases hives and asthma. So that's probably the most well-documented case of meat allergy. Some kids with milk allergy cannot tolerate beef because of some cross-reactivity between beef, especially albumins in serum albumins in beef, and that are also in milk. And then there's been another condition that's called cat-pork syndrome, which is fairly uncommon, But this is due to some people, for some reason, develop sensitization to FeLD2, which is a minor cat allergen. But this is it's a cat epithelial allergen that has cross-reactivity with pork. So developing this sensitization to this leads to a reaction to pork, and in some cases, even fatal reactions. There's one fatal reaction reported to wild boar in a patient with this syndrome. So still, though, these are immediate reactions for the most part that occur and didn't make a lot of sense. And just to refresh what these researchers were seeing, that these people, most of them were adults at this time, although kids are getting this condition as well. But and then didn't develop symptoms until 3 to 5 hours later after eating the meat. Many of them described nausea, diarrhea, or indigestion before the reaction. Some had cardiovascular events. Symptoms did not occur with every exposure to red meat. It did seem to make more fattier cuts, seemed to be important. And they all had consumed red meat for many years. They were hunters, they had eaten meat. And so why all of a sudden are they getting this condition? And as I mentioned to you, testing was negative to poultry and other meat allergens or proteins. So this was probably the key study that was published in 2009 by Scott Commons and folks. It describes 24 patients from Virginia and Missouri that were doing a collaboration with another researcher. Described these delayed reactions, positive intradermal testing, and then they also, because of some studies that they had seen in Australia, because you'll learn that this is not just a US-centric problem. We're seeing this in other parts of the world. They had started making associations in Australia about possible red meat allergy associated with ticks. And because of that, they decided to test for they had the alpha-gal antibody, let's test for it. And sure enough, found that these patients had various levels of IgE positive to alpha-gal. So but they were also saying, well, why is this happening? And many of these patients, as I said, were outdoors, and they said that they were getting bitten by ticks, not everyone. So happened that one of the researchers, Dr. Blatz-Mills, who was one of the authors of that paper, had also developed this allergy. And he actually, as a good researcher, went out and got bitten again, okay? Because he wanted to show that this is really happening. And so here you see this is his IgE level. He had positive IgE to alpha-gal. And then on September 7th, he got bitten and his IgE spiked. And then over time came back down. I mean, obviously this is an N of 1, as we all know. That's not but it did help prove the point that tick bites can cause an increase in IgE levels to alpha-gal. And what was also interesting was that, these tick bites, the tick bites that seem to be more relevant are the larval tick bites, which are very small ticks. I'll show you pictures of them later. And they can cause these very itchy reactions that almost look like chigger bites, okay? And some people say that made observations that the more reaction you get from these bites initially may dictate if you're going to develop this condition or not. So alpha-gal syndrome, this has now been called, this is what it's been called, because it doesn't fit a typical allergy, because you're getting sensitized by ticks, and yet you're eating something, it's not the same root. Usually most allergy happens by root. You eat the food, develop sensitization, and then it reacts when you eat it. So it's a very paradigm shifting disease. The three main things are that you're developing IgE specific to carbohydrate. Now, this isn't really paradigm shifting. We know this, but in most cases, when you develop IgE to carbohydrates, it's more of a nuisance. We see this a lot in testing when you test someone and they get positive to a bunch of, they get IgE positive to a bunch of things, it's because they may be reacting to cross-reactive carbohydrate determinants in the serum. And that leads to these kind of false positive reactions. So a lot of times we think that they're not clinically relevant. But in this case, and it's why it took a while for the medical community to accept this to be a true phenomenon. As we mentioned, getting bitten by ticks is a very unusual way of developing an allergy, and I'll talk a little bit about that. But now about 500,000 people in recent studies by the CDC have been affected. So is this an epidemic? And in other parts of the world also increasing. The diagnosis for this condition, about 90% of these patients, as I mentioned, have this delayed red meat reaction, 3 to 8 hours after eating. And it's pretty consistent with the type of mammalian product. And you have a positive alpha-gal serum, then that makes a diagnosis. As we've learned more about this condition, there is a group of about maybe 10% of these patients who don't present with the typical urticaria, angioedema, and anaphylaxis, but tend to get more GI-specific symptoms, a lot in children, importantly. The prognosis of this condition can be good if you stay away from meats and avoid getting tick bites. And some people have been able to go back to eating meat. But then if you do get tick bites, it has led to some people developing potentially more severe symptoms, but also sensitivity to a lot of different products, mammalian products, even with relatively little alpha-gal that we can see. And it's also been, I think, one thing I want to point out here that's been associated in some other disease states, especially cardiovascular and mast cell diseases. And so we don't have treatments for this at this point. So just like any allergy, the mainstay of treatment is avoidance, but you'll see that this is difficult because there's a lot of different products that come from mammalian meat, and they're not always clearly labeled. So it presents some unique management issues. So this, of course, there's a New England Journal article hunting for a diagnosis here. So the theory was, it makes sense here. You got ticks that are growing, that are spreading out in the community, carried by deer, and they are biting, feeding on the deer, which have alpha-gal, and then they're getting it burrowed into humans, and we're somehow getting sensitized to that alpha-gal that they took from other mammals. And we make IgE, and then later on, when we eat meat that has alpha-gal antibodies, we get this clinical reaction that leads to a hypersensitivity reaction, including anaphylaxis. However, we are finding that at least the part about how the ticks transmit the alpha-gal to humans is being challenged. We're finding that, as this shows here, this graph, that ticks themselves that are even not fed have alpha-gal in their saliva. And so it challenges the hypothesis that they're transmitting it from other mammals to us, to humans. And then some other data in studies. This is a study here showing alpha-gal after feeding on different types of animals, that humans actually are the ones that lead to the highest levels of alpha-gal in the ticks versus other types of common mammals. And when looking at actual human blood, so this is basically taking ticks that are unfed and then engorging on human blood early on at mid-cycle, which is about 4 to 5 days, and then rapid engorgement, which is over 5 days. You see that at 4 to 5 days or more, you're getting a lot more higher alpha-gal levels in the human blood, which suggests that, obviously, as we all know, the longer the tick stays on, the more chances that they're going to be able to transmit whatever the problem is. But it leads to, brings up the interesting factor that there could be tick-specific factors that are driving this. So it's not just that it's being carried by mammals and so forth. So, and then of course here, this is another study showing that where they were able to look for actual alpha gal in the tick, in the saliva, and where you see the red, that's where they're finding it. So the Ambuloma americanum is the Lone Star tick, and this is the Ixodes scapularis. So there's also finding it in other ticks. And this is not surprising because other ticks are carrying this disease in other parts of the world. And we may be starting to see some cases in the US, which I'll talk about soon. So this highlights the fact that this is not a very clear-cut process, and it depends on a lot of the host factors, human factors, and so forth. And that's what we're seeing. And not everyone who's getting bitten by these ticks is getting the disease, and vice versa. Here's our friend, the Lone Star tick, and these are the different stages of the larval stage, nymph stage, adult. As I mentioned to you, even though the highest levels, and I forgot to mention in the last slide, the highest levels are in the female ticks. So getting bitten by female ticks does have higher levels of alpha gal. But where most people are thinking is at the larval stages where a lot of this sensitization is happening. And you can tell these are very small ticks. I don't know if you can see them on this bagel here, but I'll help you here. There's 1, 2, 3, 4, and then this little guy right there. He's just hiding there. So very small. So you can't probably, so if you're bitten, you probably may not even know. And as I said, not all reactions are going to lead to this hypersensitivity reaction. So a lot of people still don't know, or at least when they get the diagnosis, they say they don't realize they've been bitten by these ticks. This is a map of the US now where we're seeing, and this was an important study that was published. I think it hit the news in the CDC study from 2017 to 2022, showing a certain, a high degree of people having, or at least reporting this condition and where they're happening. So as you can see, a lot of this is in the clear in the southeastern United States, which is kind of also the pattern of where the Lone Star tick and Rocky Mountain spotted fever is occurring. But they've found some interesting areas up here in the Great Lakes and also in Suffolk County and Long Island, where there's been a high prevalence. And some recent studies have shown that they're suspecting other ticks have led to these, but still too early to say that. So this is, it's spreading, epidemic. If we can say climate change, this is something that could be related to that. And why is this happening? And why is this happening now after, really in the last 10, 20 years? I think we still don't know the answers. So this also just kind of borrowed this slide, just kind of gives a little bit of data in terms of what we know in terms of number of people tested, suspected cases. Right now is estimated about 450,000 people. So and this would put it in terms of like total prevalence and probably like the 10th or 11th most common allergen in the US. And if confirmed, of course, a lot of this is still based on a lot of self-reported data, but could be. And as I mentioned to you, this is not a US-centric problem. This is found in all over the world. In fact, every continent except for Antarctica has cases now identified of alpha-gal syndrome. In particular, and a number of 13 different ticks in those countries responsible for transmitting it. Denmark, a study in Denmark, interestingly showed an increase, not just in the population, but also looked at some risk factors. Turned out to be male, atopy, cat at home, and then having a blood group, A or O, could predispose you to this. And this, I was talking to Dr. Gilbrand, that this could, lead to problems if you are getting transfused with other blood products, especially B type blood products. And so need to be concerned about that. And then in some of these endemic areas, we're hearing, and there haven't been a lot of published studies, but we're hearing that 20% or more of anaphylaxis cases they're seeing in their registries are linked to alpha-gal. So it's becoming a more important issue. So what are some of the clinical and diagnostic characteristics? As I mentioned to you, I've talked to you about the delayed meat allergic reactions. A good number, 3 to 20% now, are reporting these kind of more GI-centric symptoms: abdominal pain, nausea, emesis. These people could benefit from gastrocrom and some other antihistamine treatments to help prevent these symptoms. But an interesting phenomenon that's occurring in about 3 to 5% of patients is that they're starting to get symptoms consistent with a mast cell syndrome, where it may be the alpha-gal sensitization is kind of like waking up an underlying mast cell disorder. And that even if you start then avoiding meat and other alpha-gal products, the mast cell disorder has woken up. And some theories behind that is that maybe there are factors in the saliva or tick bite that can lead to total increase in IgE, or some other mast cell releasing factors that may lead to this. But this will be an interesting phenomenon. I'm sure, just like alpha-gal might be patients you see, I'm be surprised if none of you have seen a patient with mast cell activation disorder in your practice. So yeah, interesting association if that turns out to be true. And just like in most allergies, sensitization rates are high. If you did sampling of the US population, you would get very high rates of sensitization, like 10, 20% to peanut, for instance, but actual clinical reactivity to peanut is more like 1 to 2%. So we are seeing a lot of sensitization in some of these studies, but the clinical symptoms are occurring in only 1 to 8%. Again, leads to this variability in who's getting bitten, who's getting sensitized, and then who's getting clinical reactivity. There's probably a lot of other factors going on. One thing to keep in mind is if you are considering a patient with alpha-gal and you do testing, there can be cross-reactivity of positive antibodies to alpha-gal if they have cat or dog allergy, because those are mammals. So they're making IgE to those and may cause some cross-reactivity, and they may not have clinical AGS. And then this has always been an interesting challenge. We'll call it food, at the last resort, the gold standard for really understanding whether somebody has a true food allergy or not is to do a food challenge. As you can imagine, this is challenging because symptoms won't occur while they're there. They're going to occur later on. And at times where they've done challenges, about 15 to 20% of those reactions eventually have to go to the emergency room and get epinephrine. So they're having serious reactions, and that makes actual diagnosis difficult. And also, and then on the converse, about 10% of those challenges are negative, even though they have a good history. It's because they may not have eaten enough of the allergen. The bottom line here is we don't know what the dose or the threshold, let's say, of reactivity is, and that creates problems. This just tells you what are the tests that are available. We have these two tests, the alpha-gal panel and the galactose alpha 1,3 alpha-gal IgE in our system. I know that. But please don't order the alpha galactosidase A deficiency test. We don't need to look for a storage disorder, which unfortunately has happened sometimes. I have a patient referred with that positive test. Back to the tick bites and story, there is some evidence to suggest that response to tick bites, that you can get increased levels of alpha-gal IgE, and that these can then lead to some factors. But what doesn't even though you're getting those increased IgE, it doesn't necessarily lead to more severe reactions. But what it's looking to do is that it's reducing people's sensitivity or threshold to doses of alpha-gal. People who are getting more tick bites and have higher levels seem to be reporting problems to products that seemingly have very low alpha-gal amounts, including milk, for instance. They may have to stop drinking milk, but also a lot of different products such as gelatin and so forth. So some of the interesting questions is why the delayed reactions, right? Well, as I said, the alpha-gal is on carbohydrates, but a lot of times these carbohydrates are bound to lipids, so it's glycolipids. So when you digest lipids, it takes a longer time, and that could explain why the reactions are delayed. We don't really understand it completely, but that's a theory. Also, as I mentioned to you, fattier meats with higher fat content do tend to be more likely to cause reactions or severity. Does the level of antigen of alpha-gal IgE correlate with severity of reactions? Not exactly. Okay, it could, but that hasn't been what it does. And it's true for most allergies is that the higher the IgE level is, the more likely you're going to be clinically reactive to that allergen by exposure. The severity is going to depend on the dose of exposure, as always. But also in this case, it could be also dependent on other cofactors. What's been interesting with alpha-gal is that people are really susceptible to cofactors. One of these, for instance, is exercise. I know I may have talked about with some of you about the interesting phenomenon of food-dependent exercise-induced anaphylaxis, where if you eat the food, you're okay. If you exercise, you're okay. But if you eat the food and exercise together, you get anaphylaxis. So what we do tell people in those situations is, okay, just make sure you exercise 2 to 3 hours after eating your meal so that you're not going to, because that's about 1 to 2 hours is the period of when you would get clinical reactivity. But in this condition, it's 3 to 5 hours. So when do you tell them? Telling them to exercise could be, it could take a longer time for them to be in the clear from accidental exposures. Will AGS ever go away? I kind of said that to you. I did say yes, it can. Studies, at least one study has shown 12% of patients can clear over 5 years of avoidance and eat the meat again. And then why is this happening after 60 years? 60 years of people getting bitten. Why are we starting to see this now? Great question. Good research. We need that. We need that information. So going to treatment and management. Avoidance of red meat, of course, especially fattier cuts. Avoidance of further tick bites would make sense. Caution with cofactors. Exercise, alcohol. There have been a few cases or reports of fumes, meat, fumes. That's always been a very debatable issue in allergy, how people, you get people who say that they react when cooked foods are getting cooked and they inhale it and so forth. But there have been some also in this condition reported, and so we have to, and obviously people cooking meat is more common than some other foods in various places, even at barbecues, for instance. So dairy and milk, okay, for the most part, most experts in this field will not tell people who have this condition to avoid dairy unless they start reacting, of course. About 80 to 90% can tolerate dairy. But as I told you, those people who get more bites tend to get more sensitive, and those might be people who have to start taking dairy out of their diet. And the very important part of this is education, okay? Because people need to know what are the alpha-gal containing products, because we're learning that it's not just the meats. It's there's a lot of products that are derived from mammalian meat that are in our environment. And this can be a challenge because not all of these things are going to be clearly labeled as derived from meat. They have other names. And so, one study, a survey that, has caught a lot of our attention, it was that, they did a survey of consumers, and they found that 69% had never even heard of alpha-gal, and 58%, only 58% could say that beef was a mammalian product. And then on the converse, there was also a physician survey of only 42%, a little better, had heard or never heard of AGS. Still, 60% had not heard of it, and only 5% are confident in managing. So we need more information. A good source that for patients with this condition is the Vegan Med Pharmacy, who has spent a lot of effort in trying to identify different types of mammalian meat ingredients and different types of drugs. So to help you give you patients better advice about what drugs to use or avoid. The treatment, the management, all these patients, this is one type of allergic patient where you should make sure they have an EpiPen available because of the unpredictable and potentially severe reactions. But management is the same, usually antihistamines, maybe cromolyn, more for the GI-centric problems, corticosteroids. Omalizumab, if many of you don't know, has been recently approved, another indication for food allergies, multiple food allergies. So now this might be a choice to use in certain types of product patients. And then at least one study of metformin. I wasn't very clear on the mechanism, but it has shown some possible benefit in a few group of patients. Can you desensitize to this? Is there possibly, but we don't know. So here's a cow and pork and pig, just to let you know, two different types of animals and how many different types of products can be. For the most part, I think it's still a little controversial about people like touching hide or things that are coming from animals where you're not ingesting or inhaling or other things. But there are people who feel that they are that sensitive that they can't be around a lot of. So imagine, how are they going to avoid this? All of these different types of things. So that's just, saying avoidance is just really not so easy for some people. In fact, this is a condition that people are starting to say, in terms of everyone, food allergy has a decreased quality of life compared to the regular population, almost to a level of like suffering from somebody with a chronic illness like diabetes. And these patients are no different. They are likely to report a lot of anxiety, a lot of constant fear. And then the fact that, as opposed to someone with a peanut allergy, where there are laws that you have to label peanut containing products in the foods that you eat, there's no law like that. So these patients are really in the dark sometimes, and a lot of pleasure. Then, of course, not eating meats, people have lost pleasure in going out socially, and so forth. And there have been some reported, scenarios, sad scenarios, where farmers who have developed this have had to sell their farm because they can't even handle or be around the animals that they care for. Soldiers in the Army have had challenges because a lot of ready-to-eat meals have meat in them, and then also some chefs and restaurateurs unable to taste the food that they prepare because of this condition. So obviously can impact people's lives. We need to always be mindful of that. From terms of risks, again, the higher the dose of the alpha-gal, the more risky. This chart gives you a few different types of foods and medications. I'll go through a few of these examples because I think it's important. I think we all should be aware of vaccines, right? As I mentioned to you, one meat-derived ingredient of concern is gelatin. May not be so much if you ingest it, but when it's injected, I think that's more of a concern. This kind of list gives you a little bit, hopefully, of what are some of the vaccines that mainly don't have mammalian products, so those are safe. But there are some in each category, like influenza and tetanus, and even shingles that that may not be, if you have a patient with this condition, you should avoid. A lot of them are unsure because they do have low-level mammalian sub-ingredients, but they're probably okay. We're not getting a lot of reports of reactions. The only one is the MMR has had some reports, but right now that's not it's still recommended in people with this condition. A lot of times people are getting the MMR in infancy, so the risk is probably not very high. Some new RSV vaccines. Interestingly, they have this Chinese hamster ovary, which does have alpha-gal epitopes, but the type of processing may reduce them to a point where they may be okay, but we don't really have a lot of information on that. Other medical exposures, obviously cetuximab was the key drug associated with that really put this on the map. But there's a lot of monoclonal antibodies that are mammalian derived. The two that I think people seem to point to a little bit more are abatacept. It has the Chinese hamster ovary, as I mentioned, and infliximab. If, to be on the safe side, if you have a patient with this condition and you want to give them this, you can start off with the typical 10/90. You give a tenth of the dose, watch them. If they're fine, you give them the rest of the 90. Gelatin, the highest risk, and where there have been cases of anaphylaxis is to the IV plasma expander when it's used as that. Fortunately, it's not used as much in the US. And then some of the vaccines I mentioned. The gelatin in food, what you should know is fish gelatin. There's 3 types of gelatin. There's fish gelatin, and then there's beef or pork gelatin. So in a product, if it doesn't say, since fish is a major food allergen, if it's in the product, it has to say fish gelatin. So any other gelatin in the product is probably from pork or beef. Pancreatic enzymes are also come from large mammals, but they've been seem to be okay. Thyroid hormones, especially the natural armor thyroid, can be from porcine thyroid glands. So obviously that's a patient discussion with patients, because I know there's patients who are very adamant about using more natural sources, but that is something that needs to be considered. A lot of the anti-venoms too are derived from non-venom immunized non-primate mammals. There have been reports to the CROFAB for management of copperhead and other snake bites. And then of course, collagen containing products might be also to be considered. I want to just end with a few, I think one interesting, complication, let's call it complication or interesting finding that might start becoming more of an issue is this association with AGS and atherosclerosis. A lot of this data from University of Virginia, obviously, who have a very large database of these types of patients. Well, this Dr. Wilson did a study of his group of patients undergoing heart catheterization and found that about 26% of those patients had IgE to alpha-gal. And in that subset of patients, the burden, atheroma burden, was increased, as well as the less stable plaques in those persons, that you can see from this slide, okay? And that this association was higher in people less than 65, so younger patients presenting with this. So could there be some association with alpha-gal and some other atherosclerotic disease? Has also been shown in another study here by Dr. Vernon et al. In other areas as well. So something to consider. And then that brings us back to the cardiovascular procedures or considerations in these patients. who may be at increase, who have atherosclerotic disease and need medicines. For the most part, aspirin and statins are okay. There might be some preparations that have mammalian meat, and you might want to stay away from those. The beta blockers, that's always an issue with people who have history of anaphylaxis. It's not contraindicated, but you have to be careful because if they do have anaphylaxis, the beta blocker can impact IgE or management of their anaphylaxis. If that is an issue, all of you know, if you come to my clinic, this is always a question I ask is, what do you give? Give glucagon. Okay, that's why it's in the crash cart, to reverse beta blockade. And then I think a lot of interest in heparin, possible complications with from heparin, because that can also be from pork and sometimes beef sources. Reactions have occurred to especially high doses of IV unfractionated heparin in these patients. So if at all possible, you want to try to avoid that type of preparation. Typically, the low subcutaneous, low molecular weight heparin is safe, especially for DVTs. But if you're using higher doses for in cardiovascular procedures like stents and other things, need to consider sodium citrate may be a alternate in these situations. If you can't avoid the unfractionated heparin, let me consult the allergist. I mean, we'll probably tell you to pre-treat. And or there is some data to suggest that maybe starting these patients on omalizumab 8 to 12 weeks before, which is anti-IgE, may help prevent some of these reactions. Good news, and I tried to find whether these are being used, but there was because of the transplant, and I forgot to mention that in these patients, transplant is obviously an issue, not just because of the rejection possibility, but also IgE. In some studies, IgE from sera from AGS patients have bound to transplant material the same as it does to other types of antibodies. And so it is a concern, and that's where development of these alpha-gal safe, gal-safe pigs they were approved by the FDA in 2000. By company Revivicor. Their herd is right now in Iowa, and I think they are starting to use these in select cases for transplant. They also make good bacon, I hear, and do give out free samples when they get it, when they have to slaughter a pig, and they give it out free to people who sign up for it, AGS patients. So something but hopefully these are kinds of solutions, hopefully, that we can have for these patients where they can get non-mammalian types of products and transplants and so forth. And then just lastly, some ongoing issues, this whole tick that really is something that you need to be considering if you are seeing patients who have been bitten by ticks. People are proposing that alpha-gal should be part of we should have a tick panel, which includes a lot of different diseases, including alpha-gal, and that these cases should be reported, mandatory reporting to federal or state agencies. Labeling, as I mentioned, is still an issue. As I mentioned, there are no laws that tell you that you have to label it as mammalian products. And so people ask about a lot of different types of derivatives that can also be found in drugs. So if you have these patients, be prepared. They're going to ask you about these different kinds of things: magnesium stearate, lactose, carrageenan. Carrageenan is actually a seaweed, but has alpha-gal epitopes. So alpha-gal is not just from mammalian sources, as we should know. And there's some petitions and also a bill that was proposed. I don't think it's going to fly very well, but where they want to try to make alpha-gal an allergen that needs to require labeling of mammalian milk products. So stay tuned. But you're going to hear a lot about this, and hopefully this talk gives you a little bit of insight on what's going on.